Hello and welcome to this week's edition of the Research Sofa. I'm here today with Marianne Tinkler, who's a Macmillan nurse in Northern Ireland, and she's going to talk to us today a bit about the work that she does with end-of-life care. So over to you, Marianne. Can you just tell us a little bit about the work that you do?
Yeah, thanks, Emily. So this work has been ongoing for probably about 7 years. 6 years ago, I started my master's in supportive and palliative care, and I was due to write my dissertation. So I did notice that there would have been, I was working in community as a Macmillan nurse, and I would have went into mental health units. And I would have been called in to see people towards end of life who had a history of severe mental illness, and things were a wee bit chaotic, disorganized. Mental health staff would have called us in quite late, so people were withdrawn from their drugs. Psychiatrists weren't sure how to replicate the drugs into a syringe pump. Our palliative care consultants weren't sure how to replicate the psychiatric drugs because there's no massive guidelines, and they still don't exist even globally. So we would have been dealing with people at severe mental illness, late presentation, towards end of life, and it could have been quite a crisis situation where we would have found it difficult to have people quite settled towards the end of life. So this resulted in me writing my dissertation, and it was around solely people with schizophrenia within the last 3 days of life. And what that showed, it was a global literature review. It showed there was very little research in the area. And basically what it did show was that people with severe mental illness, all they wanted was a good companion at end of life, good quality of care at end of life. And they wanted people to speak to them about death and dying. So, of course, when I looked into this further, we know this doesn't exist. People with severe mental illness don't get the same quality of end of life care than somebody who's, maybe young with breast cancer diagnosis, get all the support from Macmillan, all those sorts of things. But there is a problem with them accessing services as well because of lack of motivation and different things. But barriers are due to stigma and all those things from healthcare professionals with people with severe mental illness. So what then happened from that was between raising awareness. I work in a very big acute hospital as a Macmillan nurse, so raising awareness with staff around this area, working within my local acute mental health hospital and trying to raise awareness there. The last 2 years I proceeded to do a PhD proposal, and I just got accepted onto that last Thursday. So it's with the Public Health Agency in Northern Ireland, and I am so excited to get that started in September. So I have been very fortunate to get £250,000 funding from the Public Health Agency in Northern Ireland for this project. So the project is going to be an evidence-based co-design logic model for people with severe mental illness and their end-of-life and palliative care. So it's basically trying to formulate a logic model for psychiatry, palliative care, multidisciplinary team to basically come together and not work in silos anymore. And it's to raise awareness around this area. There is a mortality gap, 20 years at the moment. When I started this work, it was 10 to 15. It's now risen to 20. But if you don't have a social network, or if you're homeless, or any of those sorts of other vulnerable situations, it can be up to 30 years. So that's massive. So I'm super excited. I am going to have to go to this level to raise awareness, unfortunately, because it can be quite lonely. But I think we're getting there. We're starting to get there. So
yeah. Well, congratulations on getting the PhD. That sounds just such important work, and
thank you. Yeah,
so much to do. And what successes have you had at your more local level in terms of raising awareness? Is there anything particular that you feel has gone well?
Well, I'm thinking what has gone well is because, as I say, I'm very on my own. It's a very, very niche area. And it's basically on the ground, trying to work with the medical staff, trying to work with the nursing staff, and then also trying to work with the mental health staff as well in recognising that somebody could be palliative. So what the really good thing that has come out of that is I'm doing a bit of work with bite-sized teaching, and we are creating bite-sized palliative care. So that's basically what it's called, bite-sized palliative care. So basically it's using the SPIC tool, which is a specialist indicator that somebody could be. It's a tool, very basic tool, formulated by the University of Glasgow. And that is a very, very basic way of recognising, even if you're not from a palliative care background, that by using this tool, it takes about 2 minutes to use the tool, that you could recognise that somebody could be within the last year of their life. And it's not about saying that you need to say, oh, they're palliative, but it's about thinking about it and how you would raise that awareness with your manager or whatever. So bite-sized teaching, as you know, is a 10-minute teaching session that is normally done within mental health settings on lunch breaks or handovers, to recognise the physical healthcare of people with severe mental illness. And mine will be based within recognising, could somebody be palliative, or could they be towards the end of their life, and having that confidence to recognise it and maybe approach a manager or say to somebody that this person, I think, is palliative, or could be palliative, because it can be a wee bit of a grey area. So it's just to try and encourage those conversations really, and initiate some awareness around it. So I would like things to be a bit more positive within the acute setting, but I'm on my own. It's a 300-bedded hospital. I also carry clinical caseload, so that's not always possible to do that. So I'm hoping via the PhD that I'll get an opportunity to bring things to the next level, So.
Yeah. And that just sounds, really, again, just say how important it all sounds to be. Is there anything finally you'd like to tell us about the work you're doing, or where you'd like to take it in the future?
Yeah, so I suppose what we would like to do with my supervisors at Queen's University in Belfast, so the plan would be that we would take this on to a postdoctoral study. So this project would be a logic model. I know logic model sounds very research based, but it is basically a model of care that would be pilot studied for 3 years again to see if that works. You would be able to implement it into practice within Northern Ireland. Ideally, I know it's a bit pie in the sky, but we'll have to have a 5-year plan. And I would love to be a palliative care nurse working within mental health that would give guidance and advice on raising awareness of people with severe mental illness, and getting them the proper end of life and palliative care that they deserve, So that would be my plan, but I'm maybe pie in the sky for that one. It's a few years off yet, so we'll see what happens.
Well, let's hope not. Let's hope your ambitions are realised, and good luck with your PhD. And thank you so much for coming and talking to us today.
Lovely. Thanks, Emma.
Thank you. Goodbye.
Thank you. Bye.